The demanding lifestyle, high-pressure professional situations, and personal commitments contribute to the increase in stress levels and as a result, escalating the occurrence of heart diseases. According to WHO reports, in India, the prevalence of coronary heart disease is 3% in rural and 7% in urban. Roughly 50 million are estimated to have this disease. It is estimated that by the year 2020, it will account for 1/3 of all deaths. An increasing number of young Indians are falling prey to coronary artery disease. With millions hooked to a roller coaster lifestyle, the future looks even more grim. Sadly, many will be dying young. While many of the hospitals tend to address cardiac treatment with a commercial approach, Bhakti Vedanta Hospital is a response to the needs of thousands who cannot afford these expensive hospitals and yet need the required intervention. Bhakti Vedanta is an institution that represents a sense of hope, a bright light at the end of the tunnel that not only provides the best-in-class medical facilities, but also shares their burden and extends to them emotional and spiritual care. Located at Mira Road in Thane district, Bhakti Vedanta Hospital is a fully equipped multi-speciality hospital providing comprehensive state-of-the-art healthcare facilities. The sole mission of the hospital is to serve humanity and is committed to provide quality healthcare, mitigate pains of one and all without discrimination and regardless of social, ethnic, religious or political affiliations. Founder Director Dr. Ajay Sankhe explains the mission of Bhakti Vedanta Hospital.
Bhakti Vedanta Hospital is following the mission which was created long back when we conceptualized the hospital, encompassing every activity which we intend to do. So mission is with love and devotion we will offer everyone a modern scientific holistic healthcare service based on true awareness and understanding of the needs of the body, the mind and the soul.
The team here understands the heartbeats of the patients, quickly responds at any hour of the day, ensuring that no patient is left unattended or leaves the hospital without getting treatment.
The dedication of all the core members which are here and who are also highly qualified, but then to serve a mission and the mission given by their spiritual master, they have been serving humanity as a large. The integrity and the ethical practice which goes on at Bhaktivedanta Hospital is really commendable, and this has been acknowledged by really many group of my colleagues who are there in India and abroad also, that Bhaktivedanta Hospital, for its high standards of ethical and integral practice as far as patient care is concerned.
Need-based treatment is given in professional environment with a lot of care. The CAT lab at the hospital is equipped with the latest technology to provide early intervention to the patients who are at risk of cardiac problems. This has led to some top doctors leaving other hospitals to join at Bhakti Vedanta.
The biggest difference here and other hospitals is, here there is, there's a lot of peace of mind that you get once you come here. That's one. Secondly, most important thing is I don't feel the patients are cheated here. Cheated in the sense they are treated very well, because if you take feedback from most patients, they are very satisfied. So that gives me a lot of immense satisfaction.
Patients recovered after serious cardiac problems have nothing but gratitude for the doctors and the hospital team. Shri Harcharan Singh is one such patient.
After he was discharged, it didn't end there. We got regular phone calls from the doctors, the assistants, the non-doctors as well. How is he feeling? Does he need anything else? We can give him home support. He need not come to the hospital for regular checkups. We have that facility that we can send an RMO to your place and do everything even before we could ask, or even without we asking. I think that's the best of decision that we took, and the best of services. I would say hospitality in true sense we would have experienced only in Bhaktivedanta Hospital.
While maintaining the highest standards of quality, the hospital has been rendering various community health programs for the poor and the needy in the rural and tribal population. The hospital undertakes a number of community projects. Interestingly, doctors and other paramedical staff come for a voluntary service to Bhaktivedanta from all over India, and they feel happy to be here as it gives them a chance to serve.